Everyone. Jenni and Kendra here. We're starting season 2. We've kind of taken about a 6-month hiatus. And we have a lot of new exciting changes here at Take Your Health Back Now. So our first I forgot we were recording. So that's one of our new changes. We're now going to try recording, videotaping our actual podcast. So bear with us. This is all new to us.
So right now we're going to record them and then we'll publish them. But eventually we might even live stream them, or every once in a while do them as a live stream. So we will keep you up to date. Just watch out for how we decide that works best for us. It's kind of a trial run.
This is definitely our first one. So in this last 6 months, we've had a lot of new exciting things happen here at Take Your Health Back Now. And we just kind of wanted to go over them. We've had a lot of questions lately, what's going on with us. So we thought we'd just make this podcast and video so everybody is up to date. First, I just want to introduce ourselves for whoever is not familiar with us. Jenni and I, we've been doing preventative health practice for the last about 20 years.
Yeah, right? A long time. Yeah, different, versions of it, but it's really all combined into what we're doing now. All the different little aspects of it that in most programs or practices or whatever you want to call them, they're all separate. They're like one thing. And we figured out that these are like the legs of health, and you put them all together, and that is really the complete picture and program.
Right, because all of these chronic conditions people are experiencing, whether it's even you just don't feel good, you just have just don't feel good, all the way up to autoimmune conditions and cancer, the full ends of the spectrum. These are all environmental issues. They start with the environment. They start with your environment or outside environment, which causes internal environmental problems. So that's why we call it preventative health. A lot of you know that. So anyway, we want to make sure that we showed you our books. We're not very good about talking about what we have done, but we really have so much experience in this arena. So we've written this book. This was right when this whole pandemic started. We pushed this out. This is more like a workbook, so it's very helpful to get people going. It really tackles the environmental side of things that you have control of. And right before that, we put this out with, is it 11 other practitioners?
I think so.
I don't even remember now. We happen to have the first chapter in this book, but everyone has their own chapter and a little bit different take on things, but it's basically the same thing. They're both good books.
Yeah, it's more of like an introduction to the less conventional approach to having control over wellness. Just little pieces of different topics. And like Kendra said, this is more like a workbook. We like to have resources for everybody. Not everyone wants to come and work one-on-one with us and become a part of our team. We
think they should.
For those people who maybe this is the first time you're even listening to us or have any kind of resources from us, we have the podcast for free. We're trying to do more videos for people to have things that way. Then we have books, which are very low cost, entry level. We have some social media, although we've moved off of the free platforms into our own private platform. So that's our membership. So that is also fairly low cost. Just keeps building up, and you can work with us all the way up to comprehensive one-on-one care in our functional medicine clinic with Dr. Ducat. So we want to make sure everyone has access to this.
Our mission, since we started this almost 20 years ago, that we have written down and we have followed this whole time, I think it's even in the book, is that we truly want to change the world. We want to change the course of what is happening. Conventional medical model is big business, and the way they make their trillions and trillions of dollars is to keep people sick. I mean, if you're dead, that's not profitable. And also if you're healthy, that's not profitable. So just keeping you sick and in the system is very profitable business. So we want a big part of this change, the shift that we're going through right now, and to self-heal and self-empowerment.
Have power over your own choices. Not just the financial big business side of
Right.
it, but it's focused on disease and it's focused on just mitigating symptoms. There's some doctors who are good people and they are stuck in that system and they just don't realize it. So they're taught to deal with acute injury, keep someone alive in the moment. They're not really taught to give someone their best life or wellness or thrive. They just want to make sure they're not dying.
Right.
And that's not what we look at. And we don't want anyone to die,
Yeah.
clearly, but we want everyone to thrive and have true wellness, and have control and understanding over what that means.
Right. And working with your own innate ability to heal yourself and maintain your health. That's what preventative health is to us.
Yeah.
So we just wanted to kind of, Jenni touched on our new Take Your Health Back Now things that we've been working on this
Yes.
last 6 months. First of all, people often ask us why we named our business Take Your Health Back Now,
Yeah.
and also why we name, the Empowerment Center the Empowerment Center. So we wanted to kind of touch on that and just briefly, anyone that's watching us that knows us knows that we get off on these tangents and we can talk forever.
So when we say briefly, it's a reminder to ourselves.
Right, we're talking to ourselves. So we are going to try to briefly just outline each of the new steps that we've taken, just so you know, and then we'll do another video podcast going a little more in depth for those of you that want more details. But so first of all, we have moved empowerment centers.
Yes.
When did we do that? It's been a whirlwind the last few months.
Yeah, it was
March?
May is when we opened, but I think the move started in March. So
think
it
so.
was just a little less than a year that we were at the location prior.
Right. So the one prior, just a little background. So I'll talk a little bit longer than I meant to. But the one prior, so we were sharing an office with a chiropractor in town when this whole thing started. And because we don't believe in not breathing, we don't believe in sanitizing everything, that's not health to us. That's not what we believe in. So we immediately decided to move and find our own place. And luckily we found this beautiful building. We're able to move into it last April. And we were there for a year, like Jenni said. That was and we called it the Empowerment Center. And we loved it, but then our landlord passed away unexpectedly. And, oftentimes in life, something that's uncomfortable is what causes you to change and move on to something better. So that's what happened. And then this new building opened up, which is actually much, much better for our needs.
Yeah,
So
and it was really close. It was actually not a super difficult move.
No, it was right around the corner.
Close. Yeah, so
a couple
if
blocks
anyone
away.
is looking for us there, we're only a couple blocks away. So, but yeah, the setup is great. The house and the building itself is in a little bit better shape, and actually it was for sale instead of leasing or renting, so it's working out better in the long run for us. We just took a little bit of putting things together. You know how moves are.
Right.
They never are as short as you imagine.
Exactly.
To get everything set up. So now we're set up in this beautiful new podcast space where we can record.
So much better than our other one. We thought it was great, but this is much better. Yes, but the center, it houses the Duquette Functional Medicine Clinic, which is downstairs on the first floor. It also is home to our preventative health practitioner training, which we now are calling our Preventive Health Institute, where we do a lot. We will explain that in a minute. But I just wanted to say, or you can say, I'm kind of dominating the conversation, why we call this the Empowerment Center.
Yeah. Because it is a place for empowerment.
Right.
I'm not great on the big explanations. I feel like it just really resonates if you think about it. It is a place for people to come. It's a safe space to kind of, speak your truth, be well. We have so many different ways you can work with us, but we're always here. So all those things kind of come together in one place. We've got big plans for the future. So it is really the Preventative Health Institute side of it. This is going to be our physical location, and we've got it set up where we can show, your own gardening, how you can be sustainable in a urban environment.
Yeah. We have a little tiny yard here, but so far we've been able to We have an herb garden, we have a garden, we have raised bed gardens that are actually producing a lot so far.
Some yummy salads.
Yes, you can just walk outside and clip our lettuce. We planted grapes, serviceberry, elderberry, mulberry. What else? Seems like there's another berry. Oh, blackberry, raspberry. But there's so much you can do in this small space to make, your eating sustainable.
Right.
Obviously, we can't do everything, but so much of it you can do.
Yes. And so many people think they need to have, a huge garden or a farm to be able to do that. And
Right.
it's not true. So we want to be able to teach people that, show them that. And then also inside, just similar to the other center too, we just have all of the kind of practicing, removing environmental toxins with being aware of EMFs and mitigating your exposure to those, indoor air quality, water quality, products, just the way of living, that whole lifestyle. We have it here. It's
what we teach,
Yeah.
but we have actually implemented it here on
Right.
every level that we can think of so that people can actually see it.
Yes.
Especially the premier or preventative health practitioners as
Yeah.
they're going through their certification, so they can help other people.
Right. And we're gonna, we were having in-person certification, but most of that class was online. And now we're planning to do more open classes. So if you're interested in preventative health practitioner training, we're going to talk about that in depth on another episode, but it is something where we're going to have more open dates for people to come in just during training and kind of learn and be in the space and soak things in that
Right.
way.
I'm part of that community of like-minded people. That's more important than ever with what's going on. There's this big divide happening. We've talked about that in previous podcasts, but it's more than ever. And it's actually exciting because, you're either basically on one side of the fence or the other, and the people that are really like-minded are coming together. And so that's another part of why we call it the Empowerment Center. Also, empowerment, we talk about frequency all the time, is the highest frequency there is empowerment. And it's about self-empowerment. So everything we do it's empowering us, but it's also empowering. Our goal is to empower you and have that effect trickle out. I wrote down on my notes, empowerment is a state of being. So that's just something to keep in mind. There's the service to self and service to others. So service to others is definitely empowering. And there's the victim mentality, which a lot of people are in right now, which is the, what can I do? Help me, and then they want somebody else to tell them what to do. That's victim mentality.
You have no control.
Right.
You can't do anything.
Yeah. Just tell me what to do and I'll do it. That's victim mentality. That's not empowered. We only want to work with empowered people and empower people.
Yeah.
So
we'll help you get there. You just have to be able to do the work.
Right. But empowerment is you're not that victim. Always that you have choice. You always have control of your situation and your reality. So that's that's why we called it the Empowerment Center. Take Your Health Back Now, our actual business, the reason we named Take Your Health Back Now. Some people think that's a strange name, but it's a call to action. I mean, that's literally what it is. We really, truly are an empowerment company. That's how we think of ourselves. But Take Your Health Back Now is you have to take your health back in order to be empowered. That's the first step to empowerment.
You have to be willing to take that control and the responsibility that comes along with it, commitment. And you have to do it now. There's too much going on in the world, in our exterior environment to say, I'll do that down the road, or once I go to the doctor and get the pill, then I'll do that after. No, you have to be in control now. You have to start taking steps now. Yeah. So that's the name, and we really mean it.
Yes. And it used to be, and we talk about this a lot, it used to be when we first started this, we'd say simple steps. Every step is in the right direction. And it was, every step you did would make an impact. But now you really almost have to do all the steps at once because everything is so crazy right now. But, if you work with us on any level, we have everything laid out. We've tried to make it as easy as possible for you to actually do all the steps at once without being overwhelmed. What else? Oh, now we have a new membership.
Yes.
We've been busy.
We have. Yeah, we're excited for season 2 here, but we haven't just been sitting around in our off time. We had a
Right.
lot going on. So
Yeah.
now we feel like we have the time to really come back to the podcast and engaging with people. But the membership is not really something that we had planned on doing.
No, it was another
Yeah.
thing that something happens that seems uncomfortable at first. So we made the decision to leave Facebook, where we had our nice little group.
Yeah.
And come up with a new community, because we do always want that, where we can continue educating you all the time as we learn. But that's how we came to make this membership.
Right.
It just kind of organically happened, and it's great. We're so excited.
Yeah, so we're on our own platform. It's the same platform. It's called Kajabi that we use for all of our training or knowledge-based programs that we have. And we're able to build a community in there. So now if you come to work with us through the clinic, or you work through a preventative health practitioner, or you just want to become a standalone member and kind of be self-led and just join the community, that's all available. So that's the membership. As soon as you connect with us and join us, you are a member for life. Or we have a couple of different options, for how you want to sign up and pay and that side of things too. But everybody gets access to everything. So.
Right, and forever, because one thing with what we do on our end, and why a lot of people get so frustrated with trying to get over these chronic conditions, is there is so much information, and it's constantly changing, and you just can't keep up. So we're really good researchers, and we're constantly researching, and we're constantly learning new things. And so that's why we made the membership lifetime access, is because there's always something new.
Right.
So I try to post in there every day. I haven't this week because I was going on vacation, but most of the time I try to keep up with it. And it is similar to a social media platform where you can post yourself, or you can ask questions, you can like posts. We have one patient that is amazing in there right now. She has been posting every day, very positive quotes, and positive, everything is positive and beautiful, and I really appreciate all her posts. We don't have a lot of interaction yet, just because it's a new platform and people aren't used to it.
Yeah, we're still kind of migrating people in and working out how they use it. People complain about being on social media like Facebook because it's just got so many issues, but everyone knows how to use it, and it's pretty intuitive. And clearly we're not, Zuckerberg level platform creators, but Kajabi is a really good platform that we like. And I think once we've used it enough, we'll be a little bit easier to help people. But I feel like the people that have just started in it are catching on, using it a lot better than the people we migrated.
I think so too, just because they were used to that Facebook group. But anyway, it's a great community. It's a great, again, like-minded people coming together, safe space.
And you get access to the community and the programs while you're in the membership. So I feel like that mindset program that we have in there, that patient that you were talking about, you could tell when she went through that, and she was so very positive on the mindset piece, and just kept that going. So
we did, I don't even remember what it was.
Last October.
That sounds about right. But we did this 5-day mindset challenge just for everybody, not even just our members. We just did it online. And we got so much overwhelming support for it. Everybody absolutely loved it, more than we even thought. So we packaged it up, and it's in the membership now, so that people can actually go through it. And that's the first part of everything we do, is mindset, because you have to get your mindset in the right place. So we always say positive mindset, but it's actually an empowered mindset.
Yes.
If you really think about it. So that's in there, and that's lifetime access. People can always come back. But we've had a lot of people that just that piece,
it's huge.
Made a huge difference with them. It's amazing. And then the second part that's in there that you always have access to is our foundational program. This is based off of 5 years of testing, I think, in the clinic. So with real world people, real world results, data, synchronicities, patterns, everything we put together and made this foundational program based on, I think it's 95% of all the people are having the same.
Yeah, there's so many
Issues going on,
commonalities,
right.
with the lab data, and then just even beyond the years of lab data, just the outcomes even before that, and the
Right.
people we've worked with in a little bit different ways,
Right.
and all of that information and research that we just see that, you know, XYZ is happening and it's causing ABC, and, you know, like you said, like 95% of the people.
Right.
And you know, these are things that it's not necessarily, you know, health advice. It's really lifestyle advice. These are environmental lifestyle diseases. You don't
Right.
have to have a medical degree in order to live a healthy lifestyle. You just have to know those foundational pieces. And with the issues of our environments and our lifestyle that we have now, knowing those biggest impact pieces that you can really work
Right.
on to make the most forward movement is important. And I feel like we just really, one of the biggest values of what we do is saving people time. Like you could,
Oh yeah, time is
yeah,
huge.
you could research this stuff and you could come up with it and you could probably put it together. People are smart.
Right.
But we've taken, you know, several of us, you know, 20 years, 15 years
Right.
doing this, and we're putting it together and saving you that time. So
Right.
that is what we do. We put all the information together, and the Body Burn Boot Camp is laid out like a boot camp. We want you to go through it and do as much as you can in a short amount of time to make a huge change. And then understand those lifestyle habits to keep that going forward. Maybe not quite as boot campy for the rest of your life.
But you know, a lot of people, this is hard work
It
because
is.
it's literally changing your lifestyle. Like Jenni said, these are lifestyle habits. So a lot of times people fall off the wagon a couple of times. So it's open again,
Right.
always. So you can always go back in and restart, and people are really appreciative of that. And all the videos and understanding, you know, it gives them a good understanding of why, because everything that we do has a purpose behind it.
Yes,
We didn't just make it up.
giving that information.
Right.
Yeah. So a lot of things you could do, like you could go online and find, you know, a 90-day detox, and they would say, you know, take these steps, eat this food, and take these supplements. They never tell you why. They just
Right.
tell you to do it. And some of those may be good. Some I've seen have really good foundational because I understand what it is.
Right.
But as a consumer, if I'm just doing that at the end of the 90 days, I'm going to say, well, I'm done. So I'm detoxed and I'm healthy.
You
Because
can
I
go
don't-
back to your
yeah.
old lifestyle.
Because I didn't understand what those things were doing for me.
Right.
And I wasn't able to really integrate that into my lifestyle.
Yeah.
So that's what
Even
we're
that's why part of the reason why we call this preventative health, and we made this preventative health training. We had to make up our own training because, you know, if we just did functional medicine, a lot of functional medicine, most functional medicine practitioners are integrative or holistic type practitioners. They're still treating linear approach or treating, you know, symptoms, or even if they are doing root cause like functional medicine, they do that and then they get people better and you feel better, but then the people go back. You know, if you don't address what caused it down the line in the first place, the environmental side of things, you're just going to go fall back into whatever was happening in the first place. So that's why we addressed everything and made up our own name.
And if people aren't empowered to keep that going forward themselves, they won't.
Right.
If they feel reliant on that practitioner to do it for them, then they feel like when they're on their own, then they can't do it. So that's a big part of our empowerment is, yes, you may be in that acute state. You've gotten to this place where you need a practitioner to get you through it, but we don't want to just tell you what to do and get you through it. We want you to understand why and have that control. And that way you are in control the rest of your life.
Right, exactly. And can maintain this and keep getting better and better and better. What else do we have in there? Oh, I just wanted to mention too, why we call it Body Burn Boot Camp. Some people think it sounds like
Like an exercise.
cheesy or like an exercise boot camp or something. The reason it's called that, well, first of all, it's hardcore. It's 90 days.
Yeah.
And it is a lot. So it is hard work. But the body burden part is all of these conditions people are experiencing is your total body burden. It's how much your body can take before it finally becomes symptomatic. And that has to do with, EMFs, with diet, where you live, where you grew up, your stressors, your traumas, the water, your cleaning supplies, your personal care products, all those things. It just keeps building up, building up, building up. Finally, your body's like, I can't take anymore. You're reacting to everything. But that's your total body burden, your body burden threshold. So that is the purpose of naming it Body Burden Boot Camp.
Yes.
So I just wanted to
explain
explain
boot
that.
camp to work on lightening your body's burden with what you have control over.
Right.
So, I always forget that it sounds so fun to me, but maybe
Right.
it doesn't quite make sense to everybody.
Exactly. So we definitely wanted to tell you why we call everything what we do, because it all has a purpose, like we said. So the preventive health practitioner, a lot of people know about that. So we recently decided to call, kind of separate preventive health practitioner program from everything else that we do.
Yeah.
Because it is our teaching side. I guess everything we do is teaching, but
Yeah.
it's different. So we're calling it the Preventive Health Institute.
And that's where we will do all of our training and working with people who want to really do this in their life. So we've worked with a few people, a very small group, and we like the way that that's going. We've gotten good feedback. We're moving forward. So we felt like we have so many resources and just programs and steps and things that are particular to it. It was a best idea to keep it kind of contained in its own
Right.
thing. So that's the branch of Take Your Health Back Now, where we'll be doing that training and certifying people. And then once they're certified, they can go out and they can spread this to their community. They can help people go through the program. They'll still be working with our programs. They're just trained on how to do that. So
right. And that's part of what's so great about if you go through this and you do this as a business, if you're passionate about helping people like we are, you go through it as a business, but a lot of health coaches, things like that, you're on your own. You have to come up with your own program and, your own documents and all of that type of thing. And we have already made them all. So the Body Burden Boot Camp that we were talking about, our preventative health practitioners, their clients go through that and they just coach them through it. All the documents, everything is made. Even the community we're talking about, the membership, all the people go into that. So they're constantly. So our preventive health practitioners don't have to make up, do all the research and do all the things. So they're essentially on our team. It's a team. And again, like-minded people empowering each other.
Yes. And it's just, our reach is not finite, or is finite. It's not infinite.
Right.
So we are growing that by creating this team of people that are using our foundational principles, our programs, are bringing people into our community, into that membership, just because we can't do it all. So if we run the institute, then they can go out and work with the people.
Yeah. And again, it comes back to our very first 20 years ago mission statement, which was that we wanted to change the world and help as many people as possible. And
just a small mission.
Save the world. Actually, our first business was called Little Miss Save the Earth, for those of you that don't know. But the thing is that, the results that we see with the people we work with are amazing, astounding. I got a really beautiful message from somebody we worked with 2 years ago last night that when she came to us, it was for GI issues and Hashimoto's, I think. But she had given up years before, she and her husband, of having a child. And then
like 8 or 12 years.
Yeah, I think she said 2008. But we got this message last night, and she graduated with us 2 years ago. But she said that she truly believes that, I'm getting goosebumps on my head, that she truly believes that our program, getting herself healthier, she was able to have a baby and they weren't even trying. And we see that a lot in here. We have a lot of babies, but
that might be a disclaimer to give some people.
Right. We had somebody recently that got pregnant. And she was not expecting that, wasn't super happy about it. And she said, I wish you would have told me before.
In jest,
Yes.
That.
Now she's very happy. But anyway, I forgot what I was going to say. I was going somewhere with that. Oh, just that, just the results are amazing. amazing, amazing. And it's not us, it's just that we have figured out how to take away that interference so that your body can heal itself. And we can only help so many people in the clinic. I mean, that's it. So with this preventive health practitioner program, that's what we're super passionate about, because we can teach these people and they can go out and help. And the amount of people, like Jenni said, the amount of people we can actually help doing it that way is
exponential.
Exponential. That's good. And finite. I mean, it just goes on forever.
Yes.
That's our goal.
Yeah.
So
we are actually, that is kind of our plan, is to really limit how many people we're working comprehensively in the clinic,
right.
Because it is very time consuming.
Right.
Dr. Duquette plans to still take on one-on-one patients. It'll just be a little bit more, I don't want to say restricted, but it'll definitely be something where we are going to review and make sure we only take the people that really, really need.
Right, really acute patients.
Yes.
That they're at the end of the rope. There's no more.
But the flip side of that is that we are growing this community of preventative health practitioners. So there will be more practitioners available to people. It's not just us at the clinic, and they'll be able to work with people on a little, I mean, it's expensive to work functional medicine one-on-one.
Right.
So this will be a little bit more affordable for those people who aren't at that really acute state where they need.
But still want to work with, have that accountability and that support. Because that's huge. Because you can do this on your own, but for most people, we've noticed lately, especially with this last year, it's almost like, because everything has become remote, it's like people are craving that interaction with real people. And so I think the working one-on-one with somebody has become much more important just for that connection.
It does seem like that.
Yeah. So that's our Preventive Health Institute, which is here. And again, we have our whole teaching center. So when people come, we do, well, we weren't going to talk about this. We're going to talk about that in a different podcast.
In another episode.
Yeah. We get so excited about all these things. We're like, let me tell you all the things.
And just so everyone knows, the Preventative Health Institute right now, it's just our training, which we have online. You do have to contact us directly to be able to apply for and get accepted to that.
Right.
And it's just physically here in our location now, but we are working on getting that web presence up. So it'll have its own web page that talks about that side of things. And as soon as that's finished and available, we'll announce that. So listen to the next couple episodes, because that should be coming soon.
Yes, that's within the next couple of weeks. So, but the preventative, like if you were someone that was interested, you can sign up if it feels like it resonates for you and start going through the online program. But you do have to come to a weekend here. We have certain dates available for our certification. I think it's 2 days long, right? Saturday and a Sunday.
Yeah, if we had, we were doing very, very small classes because of the restrictions going on.
Right.
So if we decide to make them a little bit bigger, it might go 3 days just to make sure that it has one-on-one. But right now we're doing 2 days.
Yeah, and we only take 6 people at a time. So the very first opening that we have for that on the calendar is in October. I don't remember what the date is, but if that is something you're interested in, you can sign up now, go through the online part of it, and then be ready for that certification. It's all question answer, one-on-one, working with us. The second day is about the business side of things, because we want you to be set up and ready to go with your business when you're done. And then a certification test, and you get certified. It's pretty awesome. So
it's October 9th and 10th is what we have on the calendar right now.
Yeah, 9th and 10th. So just keep that in mind if you're interested.
And reach out to us directly if you're interested in that. We'll put links in the show notes. But for right now, like I said, as of today's date when we're filming this, we don't have the Preventative Health Institute web presence up. We just have the direct link to us, and then we go one-on-one and get you into it.
Right. 2 more things, then I was going to say hang up. Then we'll be done. This is going longer than we meant to. We do have our new podcast season. Obviously, that's new, where we'll be doing them more often like we were in the beginning. And if anybody has any topics that they want to hear about, feel free to message us, and we would be happy to do that.
click on it, send a message, email us. We are available in so many ways. I don't feel like I need to even list them.
No, you can find us if you want
Yes.
to. And then the other thing that we have available within this last year is we have a Telegram account. So you can follow us there. We try to make our community very positive and empowering, obviously. But
On our membership side.
right, on the
Yeah.
membership side. But we very strongly believe in knowledge. Knowledge is the key to empowerment.
Mhm.
And you have to have knowledge in order to sit back and see what resonates with you and your intuition and make choice. So
Right.
choice is empowered, a state, and knowledge. So the Telegram account is just, I feel like everything I put on there is bad.
It's not really bad.
It's not
just a little
bad.
Scarier.
It's just reality, what's happening right now. And it gives you a take that you do not see on social media, regular media. This is actually real stuff that's happening. I don't put everything. I mean, there's so much, but I try to put enough that it makes you want to go deeper and do your own
Yeah,
research.
that's the thing. We want to empower people
Right.
to at least know that it's out there so that they can look into it, research it, and come up with their own decisions instead of just
Right.
being told what's happening.
Yeah, exactly. So, I mean, there is a lot on there. Definitely check that out. Just
I
so that
will
you're,
link that because that is, I feel like Telegram sometimes is a little harder to find
yeah,
accounts
it's kind of
on.
strange because you have to
Yeah.
have a long word. And,
So I will link that in
Yeah.
the show notes for people.
okay, perfect. And I think that's everything that's new here in the last 6 months. There's been a lot.
There is. So it's all been very good. Some of it was a little challenging. We've had a lot of growth, I
Right.
feel like. But it's all been good. We can see the positive place that things are going. And I'm excited to get back to our podcast.
I am too. I did too. I missed this and I missed all our things. But this last year, we weren't really taken off track like a lot of people because
Right.
we knew this was coming. Maybe not this exactly what happened, this pandemic, but we knew this was coming. Even in our books, we said we're at the tipping point.
Yeah.
We didn't quite know how close on track we
Or how
were.
big of a tip it was. Gonna
Right.
be.
But we are excited because everything that has been going on for decades that has been making everybody sick and making people disempowered needs to change. And we are going through that right now. And it's going to get hairy, but it's exciting because you cannot have growth without discomfort. And so
Yeah.
we're in that discomfort stage right now. I recently got to go to a conference in South Dakota. It's been a month now. It seems like last week.
Yeah.
I haven't even talked about it. Every time is going by so fast. But with some amazing doctors and scientists and all kinds of people. And many of them described it. What we're going through right now is like, the caterpillar was prior. We're in this cocoon stage right now where we're going to birth this new, a lot of people are talking about this new world or this new earth or this new way of living, this empowerment life. So we're in that cocoon right now, and that's the uncomfortable part. But yeah, so we're super excited, and we were lucky enough to have insight or whatever to build this thing before this all started.
Yeah.
But this truly is the new way that people have to live. I mean, it will be the new way. And I keep thinking about if everyone did exactly what we teach you, we talk about your health, but truly, if you did everything the way we teach you, it would solve all the climate issues. It would
Yeah.
solve all of the animals going extinct, the insects going extinct, everything it would bring everything into balance.
Right. Because if you are really working towards balance and gratitude in your own life, it ripples out, creates balance and gratitude and empowerment in the next person, the next person, the next person in the world.
Right.
Yeah.
And all life, because we are all one giant ecosystem. I think that's a big part of this too.
Yeah.
It was kind of service to self. Humans are separate from everything else, that type of thing. And now people are starting to wake up and realize, oh, we're all one ecosystem. If these animals are dying, so are people. We're all one. We're all have to work together. So anyway, I'm getting completely off topic. So I think that's it for this podcast. So we're excited to be back.
Yes.
Hopefully
Look
enjoyed
out
this.
for episode 2.
Yeah, hopefully this actually videotaped us and you can hear us because this is our first try at this. So yeah, so have a good day, everybody. Talk to you soon.